This week's AI story is not one launch. It is the stack tightening from every side at once. OpenAI pushed health intelligence into ChatGPT, rare disease work, life sciences research, enterprise spend controls, policy hiring, device hiring, and talent warfare. Anthropic spent the week in a very different spotlight, trying to resolve reported U.S. restrictions around Fable and Mythos while the industry argues about whether cloud-hosted frontier models are now export-controlled technology. GitHub and open-source teams kept turning AI coding into governed infrastructure. Kimi remained the open model pressure story. And the Strait of Hormuz matters for AI because energy is not a side quest. Data centers run on power, chip supply chains run on shipping, and every serious AI build-out is exposed to geopolitics. So this weekly mega is simple: receipts first, big picture second, no pretending every headline is isolated. Hit subscribe if you want weekly AI coverage that treats the models, the policy, the infrastructure, and the economics as one system.
Powered by artificial intelligence.
The biggest OpenAI story this week was health. OpenAI says more than 230 million people use ChatGPT each week for health and wellness questions. That number changes the conversation. Once hundreds of millions of people are asking an AI system about symptoms, medications, lab results, wellness, doctors, and anxiety, the product is no longer just a general chatbot. It is a public health interface, whether the company wants that label or not. OpenAI's GPT 5.5 Instant Health Update is framed around better answers, broader access, urgent care recognition, context gathering, communication quality, and reduced factuality issues in monitored production traffic. The important part is not just that the model improved. The important part is that health is now a core product battleground. Consumers want help understanding medical information. Regulators want safety. Doctors want tools that support clinical work without creating new liability. The winning health AI product will not be the one that sounds most confident. It will be the one that knows when to slow down, ask context, admit uncertainty, and push the user toward professional care when the stakes are high. The hidden star of the health update is evaluation. OpenAI points to HealthBench and HealthBench Professional, which use realistic health conversations and physician-written rubrics. Those rubrics look at accuracy, safety, context awareness, communication, completeness, and escalation. That is exactly the right direction because health is not a domain where a fluent answer is enough. A good health model has to notice missing information. It has to say when it does not know. It has to distinguish low-risk wellness questions from symptoms that require urgent care. It has to avoid false reassurance and avoid panicking users unnecessarily. Those behaviors are hard to capture in a simple leaderboard. That is why HealthBench and LifeSciBench matter together. They show that AI companies are building domain-specific measurement systems around high-value fields. The real race is not only model intelligence. It is whether the company can measure the behavior that matters in the domain it wants to enter. The rare disease story is the grounded version of the medical AI promise. OpenAI highlighted work using AI to help physicians diagnose rare genetic diseases affecting children. That is a much better framing than the lazy claim that AI will replace doctors. Rare disease diagnosis can involve scattered records, symptoms that do not fit obvious categories, genetic information, family history, and long diagnostic delays. AI can help organize the evidence, surface patterns, and support a clinician's thinking. The key phrase is support. The strongest version of medical AI is not a chatbot pretending to wear a white coat. It is a system that makes expert humans faster and more thorough. It helps the doctor ask better questions, notice rare possibilities, and explain reasoning. That also means the deployment context matters. If the tool is used by physicians inside a review process, the risk profile is different from a consumer using a chatbot alone at midnight. Medical AI is going to move through multiple channels, and the safest channel is probably expert augmentation first. OpenAI also pushed the life sciences research angle. Its near-autonomous AI chemist work points toward systems that can help improve challenging reactions in medicinal chemistry. That is different from a model simply summarizing papers. It is a step toward AI participating in research loops, reading context, proposing plans, reasoning through constraints, and helping improve an experimental process. LifeSciBench belongs in the same bucket. If models are going to help with scientific work, the field needs better ways to evaluate them. Scientific reasoning has to handle uncertainty, procedures, data quality, safety, and domain-specific constraints. A model can sound brilliant while being wrong in exactly the wrong way. The big read is that AI science is moving beyond chat. The valuable product is a workflow, model plus tools, benchmarks, experimental records, and human expert review. OpenAI's enterprise spend controls update may be less flashy than health, but it is one of the most important business stories of the week. The first phase of enterprise AI was access, give people seats, run pilots, let teams experiment. The next phase is management, who is using AI, for what, at what cost, under what policy, and with what business value. Usage analytics and spend controls are how AI becomes boring enough to scale. Finance teams need predictable spending. Security teams need visibility. Leaders need to know which workflows are worth expanding and which are just burning tokens. This is also where agentic AI gets serious. Agents do not just produce answers, they consume model calls, tool calls, logs, retrieval, review, and sometimes cloud runtime. Without controls, the most exciting AI workflow can become a cost surprise. The enterprise winner may not be only the smartest model. It may be the platform that lets companies manage AI like real infrastructure. Axios reported that Dean Ball is heading to OpenAI to lead a strategic futures unit focused on frontier AI policy and governance strategy. Treat that as reporting, not a company blog, but the signal is obvious. OpenAI is adding policy capacity at a moment when governments are writing the rules for frontier systems, user safety, national security, export controls, child safety, and competition. This matters because policy is not just public relations anymore. It shapes product design, release timing, model access, audit structures, safety cases, and how a company talks to regulators before trouble arrives. Frontier labs are becoming political actors because their products are becoming infrastructure. The companies that understand policy early may move faster because they know where the constraints are. The companies that ignore policy may discover the constraints only when a launch gets blocked. Axios also reported 2 talent moves that point beyond the model API. Hatai is reportedly leaving Meta to lead communications for OpenAI's devices division, and Noam Shazir is reportedly leaving Google for OpenAI. Put those together and the story is bigger than hiring. OpenAI is fighting for the model layer, the policy layer, the enterprise layer, and the consumer interface layer at once. The device question is really an interface question. The phone already exists. Smart speakers already exist. Wearables already exist. An OpenAI device cannot win just by being another gadget. It has to explain why AI deserves a new default place in daily life. That means trust, privacy, memory, context, and usefulness have to be designed into the product. If the model is always around, users will ask what it hears, what it remembers, what it can do without permission, and what happens when it is wrong. That is why communications and product design are strategic, not cosmetic. Anthropic's week was dominated by Fable and Mythos. The New York Post reported that Anthropic floated a proposal to Commerce Secretary Howard Lutnick aimed at ending U.S. restrictions on access to Mythos and Fable. The Verge framed the same situation as an export control puzzle that the industry does not fully understand. That is the key point. This is not just an Anthropic product dispute. It is a test of how governments may treat access to frontier models. If a model can be restricted like sensitive technology, product architecture changes. Companies need identity controls, jurisdiction controls, access logs, customer segmentation, employee access rules, auditability, and legal review built into distribution. API access becomes a policy surface. Internal eval access becomes a policy surface. Contractor access becomes a policy surface. Every lab is watching because today's Anthropic negotiation could become tomorrow's launch checklist for everyone. The hard part is that cloud AI does not map neatly onto old export control categories. Traditional export controls were built around physical items, technical data, chips, military components, and explicit transfers. A frontier model accessed through a cloud service is different. It is capability delivered through identity, networking, contracts, and logs. So what counts as foreign access? A customer calling an API? An employee outside the United States running an evaluation? A support engineer debugging a prompt? A fine-tuning job? A hosted agent that calls the model indirectly? These details are not trivia. They are the compliance system. If governments want frontier model controls, companies need definitions they can actually implement. Otherwise, policy becomes an emergency brake with no dashboard, and every global customer starts wondering whether today's model access can disappear tomorrow. Even while the Fable and Mythos story was unfolding, Anthropic's enterprise push kept moving. Anthropic and TCS announced a partnership to bring Claude to regulated industries and to tens of thousands of TCS employees. That is a very different route to adoption than consumer chat. It says the enterprise AI market will be carried by consulting, system integration, training, compliance, and industry-specific workflows. Regulated industries do not want a magical black box. They want systems that can be governed, audited, integrated, and explained to risk committees. This is where Anthropic's public trust work also matters. The public may want AI benefits, but people also worry about regulation, liability, misuse, and whether AI companies can police themselves. The enterprise buyer is asking a version of the same question: can this model be useful inside a serious organization without creating unmanageable risk? GitHub's Copilot code review update is the software infrastructure version of this whole week's theme. GitHub says organizations can control whether Copilot code review runs on standard GitHub-hosted runners, self-hosted runners, or larger runners. Admins can lock defaults. Content exclusions now apply to Copilot code review. Custom instruction changes also matter because repository policy can shape how the AI reviews code. This is what mature AI tooling looks like. It is not only about whether the model can write a useful comment. It is about where the model runs, what files it can see, what policy it follows, and whether an organization can prove those controls were enforced. For regulated companies, AI code review has to fit into the same governance world as CI, secrets, vendor code, generated files, and security scanning. AI coding is becoming part of the software factory, and the factory rules are catching up. GitHub's self-hosted runner enforcement might sound like plain maintenance, but it belongs in a weekly AI video because modern AI workflows ride on CI infrastructure. AI code review, test generation, agentic development, security checks, release notes, dependency updates, and deployment automation all flow through the same pipes. If the runner fleet is stale, the AI workflow inherits that weakness. If enforcement deadlines break jobs, the agentic layer built on those jobs also breaks. If a self-hosted runner has outdated security posture, the AI tools running on top of it are not magically protected. This is why the AI stack is getting operational. The glamorous model call depends on the unglamorous machine running the job. Runner hygiene is now AI hygiene. The open source side kept building the control layer too. Hugging Face introduced Surge, a GitHub native AI code reviewer that maintainers can call and pull requests and guide with repository-owned review policy. AI2 released Almo Eval, an evaluation workbench for the model development loop, including support for agentic and multi-turn evaluation. Together those projects show that OpenAI infrastructure is expanding beyond weights. It is review process, evaluation records, reproducibility, and policy that developers can inspect. That matters because trust cannot only live in private dashboards. Open source teams need tools that help maintainers improve quality without flooding projects with low-signal machine comments. They also need evaluation systems that make model changes comparable over time. The future of OpenAI is not just a download link. It is a workflow that people can audit. You flagged Kimi K2.7 as interesting, and that is worth including carefully. During production I could not tie the exact K2.7 label to a reliable public source, so we are not going to claim it as confirmed. The verified story is still strong enough. Kimi K2.5, Kimi K2.6, agentic features, and Kimi-based coding economics are putting pressure on the model market. Business Insider reported earlier this year that Cursor acknowledged Composer 2 was built partly on Kimi K2.5, and that cost was a major part of the story. An independent AR14 safety evaluation described Kimi K2.5 as an open-weight model with strong coding, multimodal, and agentic capabilities, while also raising dual-use risk concerns. That is the tension. Open-weight models can lower the cost of capable coding agents and make innovation faster. They can also make powerful capabilities harder to govern. The Kimi story is not just China versus the United States. It is a preview of a market where strong models become cheaper, more available, and harder to control. The Kimi safety question is bigger than one model. Independent evaluators looked at Kimi K2.5 and focused on risks likely to be amplified by powerful open-weight systems, including cybersecurity and CBRNE misuse. The lesson is not that open models are bad. The lesson is that open distribution changes the safety problem. When a closed model is served through an API, the provider can enforce some access rules, monitor abuse, update refusals, and cut off accounts. When powerful weights are widely available, many of those controls move downstream or disappear. That means safety depends on deployment choices, application layer limits, hosting providers, enterprise controls, and law enforcement rather than one central model provider. The open model ecosystem has enormous upside, but it needs its own safety architecture. Otherwise, we get cheaper intelligence without enough operational restraint. The Strait of Hormuz matters to AI more than people think. Business Insider reported that ships have started moving again after months of stalled traffic, while The Guardian reported that normal shipping will not resume until mines blocking the route are cleared. The New York Post reported conflicting Iranian statements over whether the strait was open or closed, and the Wall Street Journal reported that the reopening shifts focus to oil storage and shipping bottlenecks. So the clean headline is not, "Everything is fine." It is, traffic is coming back, but the system is fragile. Hormuz is one of the world's most important energy choke points. If shipping is disrupted, oil and LNG markets react. If energy prices move, data center economics move. If shipping insurance and routing change, the cost of infrastructure changes. AI is not just chips and code. It is power, cooling, logistics, and geopolitical stability. The AI impact of Hormuz is indirect but real. Training and serving frontier models requires data centers, and data centers require enormous amounts of reliable power. Power markets are linked to fuel markets, and fuel markets are linked to shipping choke points. Even when a company buys renewable power or signs long-term contracts, the broader grid and infrastructure build-out still live inside energy economics. There is also a supply chain angle. Chips do not appear by magic. Semiconductor manufacturing depends on chemicals, gases, equipment, components, shipping routes, and global coordination. A shock to shipping and energy does not instantly stop an AI model from answering a prompt, but it can change the cost of building the next data center, the price of backup power, the timing of equipment delivery, and the risk assumptions behind expansion plans. That is why AI companies are increasingly energy companies by another name. Put the week together and the pattern is obvious. Health AI needs evaluation, physician review, escalation rules, and uncertainty handling. Enterprise AI needs dashboards, spend limits, usage analytics, and security visibility. Frontier model access needs jurisdiction controls, identity, audit logs, and policy negotiation. AI coding needs runner governance, content exclusions, and repository policy. Open models need downstream safety architecture. Data centers need energy resilience. That is not one trend. That is the whole market maturing. The model is still important, but the model is no longer the entire product. The product is model plus evaluation, controls, policy, workflow, pricing, hardware, power, and trust. The companies that win the next phase will not only release stronger systems. They will make those systems manageable enough for the world to actually use. The health business model is trust. That sounds obvious, but it is different from the business model of most consumer software. A social app can optimize for engagement and survive a lot of messy behavior. A health AI product cannot simply maximize session length or user dependence. It has to help people understand information while protecting them from overconfidence, panic, and false reassurance. That makes the product challenge unusually hard. The model has to be warm enough that people will ask real questions, but cautious enough not to overstep. It has to be simple enough for non-experts, but precise enough not to flatten important medical nuance. It has to respect privacy while still gathering enough context to avoid bad answers. It has to encourage users to seek professional care when appropriate without turning every answer into a useless disclaimer. This is why OpenAI's emphasis on physician evaluation and benchmarks matters. If the product becomes trusted, health may become one of the biggest AI categories in the world. If it fails visibly, regulators and the public will not treat it like a normal app bug. They will treat it like a safety failure. Health AI is a huge opportunity, but the tolerance for sloppy product behavior should be low. Scientific AI has a different failure mode from normal chat. If a general chatbot makes a small mistake in a summary, the damage may be limited. If a scientific assistant misunderstands a protocol, invents a citation, or proposes a reaction path that cannot be reproduced, the cost is time, money, and potentially safety. That means scientific AI products need evidence trails. A useful AI chemist or life sciences assistant should show what it used, what assumptions it made, which constraints mattered, and how a human can verify the recommendation. The model should not only produce an answer. It should produce a path that researchers can inspect. That is why LifeSciBench and AlmoEval belong in the same weekly story. They are both about moving from impressive outputs to measurable workflows. In science, trust comes from reproducibility. The AI system needs to fit into that culture. It should help generate hypotheses, compare options, search literature, and organize experimental records. But it should also make it easier to catch mistakes. The labs that build AI for science as an evidence system, rather than a magic oracle, will have a much better chance of earning real adoption. The Anthropic dispute points to a new design requirement: access architecture. In the early API era, access mostly meant account creation, billing, and abuse monitoring. Frontier systems are pushing that into a more serious category. If governments treat certain model capabilities as sensitive, labs need identity controls, jurisdiction controls, internal access tiers, evaluation permissions, logging, revocation, and compliance workflows that can survive legal scrutiny. This is not only a policy department issue. It affects product engineering. Where is the user? Who owns the account? Who can see the prompt? Which model tier is being called? Can a restricted model be invoked through an agent? Can a contractor in another country inspect logs? Can a customer fine-tune or evaluate a model that is restricted in another context? Those are engineering questions with legal consequences. Access architecture may become as important as model architecture. A lab can have the strongest model in the world, but if it cannot prove who can use it and under what conditions, it may not be able to sell it globally. The next frontier launch will need a launch blog, a safety case, and an access control plan. Enterprise procurement is where AI hype meets paperwork. That sounds dull until you realize paperwork is how big software actually gets bought. A company choosing an AI platform now has to ask about data handling, usage analytics, spend controls, audit logs, admin permissions, model routing, content exclusions, retention policies, and integration with existing identity systems. That is a lot more than, does the model write a good paragraph? OpenAI's spend controls, Anthropic's regulated industry partnership, and GitHub's Copilot review controls all point in the same direction. Enterprises are not just buying intelligence. They are buying governable intelligence. They want to give employees powerful tools without losing track of cost, risk, and compliance. They want to know whether the model is used for customer data, source code, legal analysis, financial decisions, or internal experimentation. This is why the AI platform market may consolidate around trust surfaces. The model will still matter, but procurement teams may choose the product that makes risk legible. The easier a vendor makes it to answer audit and budget questions, the easier it becomes to approve bigger deployments. Coding agents are not only a capability problem. They are an economics problem. A human developer might ask for one answer. An agent can loop, read files, propose a patch, run tests, inspect errors, retry, open a browser, summarize logs, and generate review notes. Every loop consumes model calls, tool calls, and infrastructure. If the model is too expensive, the agent either becomes costly or artificially limited. That is why Kimi matters even without a source-confirmed K2.7. Kimi K2.x pressure shows that strong open or lower-cost models can change the economics of coding products. Business Insider's Cursor report is a useful example because it connects Kimi to a real coding product and cost discussion. If a company can get good enough performance at a fraction of the price, it can run more agent loops, offer cheaper plans, or reserve premium models for the hardest tasks. The future of coding agents is likely model routing. Cheap model for simple edits. Stronger model for architecture. Specialized model for tests. Premium model for high-risk refactors. Human review for production changes. The winner will not be one model doing everything. It will be the workflow that balances quality, risk, latency, and cost. Open models create a strategic squeeze for closed labs. If open-weight or lower-cost systems get close enough on coding, research, and agentic tasks, closed labs have to justify their prices with more than benchmark charts. They need reliability, product polish, enterprise controls, support, safety monitoring, indemnity, integrations, and trust. This is healthy pressure in one sense. It stops the market from becoming a small club of expensive APIs. It gives startups and independent developers more options. It pushes closed providers to compete on usability and governance, not only raw intelligence. But it also creates harder safety questions. Once capable weights circulate, the central provider has less control over downstream use. Attribution can get messy. Distillation accusations can get messy. Licenses can get messy. Safety norms can fragment. The Kimi story sits right in that tension. It is exciting because capable open models make AI cheaper and more broadly available. It is concerning because capability distribution outruns the governance systems around it. Both can be true at the same time. That is why open model competition will be one of the defining AI stories for the rest of the year. The Strait of Hormuz story is a useful reminder that the cloud is physical. AI companies talk about models, tokens, agents, and benchmarks, but underneath all of that are data centers, land, transformers, substations, cooling systems, backup fuel, network links, equipment shipments, and power contracts. Those systems are exposed to the real world. If a major energy choke point is disrupted, the effect is not always immediate in your chat window. But it can show up in electricity prices, fuel costs, shipping insurance, delivery timing, and infrastructure planning. If oil and LNG flows are unstable, countries and utilities respond. If shipping is fragile, hardware logistics become more complicated. If energy security becomes a board-level concern, AI expansion plans get reviewed through a different lens. The AI build-out is now large enough that energy resilience is strategic. Companies with better power contracts, better siting, better cooling, better grid relationships, and better backup plans may have an advantage. The model race is increasingly a power race. Hormuz is not a semiconductor story in a narrow sense, but it is a supply chain story, and AI chips live inside supply chains. Advanced chips require fabrication equipment, chemicals, gases, substrates, packaging, networking gear, power systems, and a long chain of suppliers. Those inputs move through global logistics. They are priced inside global energy markets. They are exposed to insurance, routing, port congestion, and geopolitical risk. When AI demand is exploding, even small delays matter. A delayed transformer can delay a data center. A delayed cooling system can delay deployment. A shipping bottleneck can make already scarce equipment harder to schedule. A fuel price spike can change operating assumptions. That is why serious AI planning cannot stop at GPU purchase orders. It has to include electrical infrastructure, logistics, and supply chain resilience. The companies and countries that treat AI as industrial infrastructure will think this way. The ones that treat it as pure software will be surprised when physical constraints decide the timeline. Behind all of these stories is the public trust gap. Anthropic's public record work showed that people can be excited about AI benefits while also worried about safety, liability, jobs, and whether companies can govern themselves. That tension appears in every major story this week. Health AI needs trust because people may use it in vulnerable moments. Enterprise AI needs trust because companies are putting it near data, code, and decisions. Frontier access needs trust because governments are asking whether some models are too powerful to distribute normally. Open models need trust because distribution is harder to control. Energy infrastructure needs trust because communities and regulators want to know why data centers deserve scarce power and water. Governance is becoming product-market fit. A company that cannot explain how its AI behaves, what it can access, how it is evaluated, and who is accountable will struggle in serious markets. The trust gap is not a public relations problem. It is a product constraint. For builders, this week has a practical playbook. First, build controls early. If your product uses AI in a serious workflow, add cost visibility, access rules, logs, human review, and failure reporting before customers force you to. Those features are much easier to design from the start than to bolt on after an incident. Second, choose models by task. The Kimi story, GitHub controls, and enterprise spend discussion all point toward routing. Use the model that fits the risk, latency, price, and quality requirement. Do not turn model choice into brand loyalty. A support summary, a code migration, a medical explanation, and an autonomous deployment do not need the same risk posture. Third, treat infrastructure as product risk. If your AI workflow depends on cloud capacity, data center availability, GPUs, power, or shipping timelines, track those assumptions. The Strait of Hormuz may seem far away from your app, but energy and logistics have a way of showing up in margins, pricing, and availability. AI builders are becoming infrastructure planners whether they plan to or not. For regulators, the lesson is also practical: rules need implementable definitions. If a government wants to restrict access to a frontier model, it has to define access in a way engineers can enforce. If health AI needs oversight, regulators need to distinguish consumer education, clinical decision support, diagnosis, and treatment. If open-weight models create dual-use risk, the policy tools will not look the same as API monitoring. Bad AI policy can fail in two directions. It can be too weak and let serious risks slip through. Or it can be too vague and freeze useful deployment while missing the actual failure modes. The goal should be targeted, auditable, and technically grounded oversight. The best regulation will probably focus on evidence, evaluation results, incident reporting, access controls, red team processes, deployment context, and accountability. The worst regulation will focus on slogans. This week made it clear that AI policy has to become more technical because the systems themselves are becoming infrastructure. Here is the watch list for next week. First, Anthropic. If Fable and Mythos get a formal access path, every frontier lab will study the template. If the situation stays vague, global customers will price in regulatory surprise. Second, OpenAI Health. The company has made big claims about health intelligence and evaluation, so the next question is whether independent clinical and safety observers begin to trust the direction. Third, Kimi and open models. I will keep watching for a source-confirmed Kimi K2.7, but the broader Kimi story already matters because low-cost open-weight coding models pressure every closed-model coding product. Fourth, Hormuz. If shipping really stabilizes, AI infrastructure gets some energy relief. If the route remains fragile, power and logistics stay part of the AI risk map. That is the week: health, policy, open models, coding infrastructure, and energy all converging. Comment with the story you want on the next desk, and subscribe for weekly AI coverage with receipts.